Tino Sanandaji. He is a researcher at the Institute of Economic History at the Stockholm School of Economics. Thanks so much for being with us. So 8% economic contraction, relatively low compared to its EU counterparts. Still, do you think Sweden has won or lost here?
Well, it's slightly lower than average of European Union, but Sweden has done worse than all our neighboring countries with similar economies. We have done worse than Denmark, worse than Norway, worse than Finland. So the question is, what are our counterparts? And the countries that are bringing down Europe are mainly the countries like Spain or Italy and Greece that are very tourist and travel heavy. Whereas these countries like Sweden or Denmark that are advanced digital economies that are more of a comparison point to us, we are not outperforming them. And American Nobel Prize winning economist Paul Krugman pointed this out, and he said the only thing the Swedish strategy got us in economic terms is a bunch of dead Swedes. Moreover, our unemployment numbers are also doing worse. We have increased about twice as much as our neighboring countries. So I don't think that this strategy economically was very successful. Of course, still, we are only in half the year. Maybe if Sweden continues to perform and sort of surpasses those countries, it's possible. Okay. But so far, there really is no such evidence.
Some argue, though, Swedes are kind of comfortable with perhaps losing more lives than their neighbors in order to prevent not just, more severe economic damage, but to protect the mental health of the population. It's been an argument in many parts of the world that we're actually causing more mental and social damage than we're actually saving lives. Do you think that applies to Sweden? Has that been a fair trade-off at all?
So you can certainly argue that you save convenience. It's not convenient to put on face masks and stuff like that. But there is no evidence that they are performing better in terms of mental health. In fact, mental health problems are growing a lot in Sweden. I'm not saying that's necessarily because of Corona, but we have to discuss things like we have a huge backlog because our healthcare system, not now, but these previous months have been overheated or by dealing with Corona. We have cancer patients that are not getting help. We have relatives of all these people who are dying. I would consider your brother or parents dying a mental health problem.
Right.
And this thing about Sweden having lower infection rates, remember, we are testing far less. We still have, this last month, 3 times as many deaths per capita than our neighboring countries. So I don't think that's very, very dangerous misinterpretation that the number of cases we are capturing is not really the correct measure. The better measure is look at hospitalization or deaths, and we still are slightly higher, although it has, of course, fallen a lot compared to the beginning of the year.
Okay. It's really interesting to hear from you because, there are divided camps in Sweden over those who say, no, this has worked, it was worth the sacrifice, versus those like yourself who say this was not worth the number of lives we actually lost. It didn't have to be that way, and we should really only be compared to our immediate neighbors who exist on the similar measures that Sweden does. Yes. Economically and socially. So yeah, I'm surprised, not surprised I should say, but it's interesting to hear you say that, oh, we did the record number of tests and only 1.2% positivity rate. It doesn't give you reason to celebrate.
But those are tests that are different. They're giving people tests to test themselves. This is different from having a medical professional test you. So the tests are also not the same. We are changing the way we are testing. And look, at the end of the day, everybody knows the death figure is an objective measure. Hospitalization is a fairly objective measure. That can capture. Testing, we've known it's all over the place. Why is testing? It actually doesn't make any sense. If we really had very low corona levels, why are people dying? Okay. So what you said about polarization is true. It's all over the world, and Sweden is used. All the world is divided, and Sweden is used as an ideal for those who are arguing for similar policies in their country, and is used as an example of fear. You're saying, why is this very developed country the 13th worst in the world in death rates? So, but I will also say that in Sweden, initially there was a massive support for the government's handling of Corona. massive. You had 60, 70, 80% support. The latest poll, this support has dropped a lot. I think the latest support, the government had 35%. It's not exactly comparable, but something like that, support for the handling of corona. So in Sweden, there is less enthusiasm about this policy. I don't think if we had known that 6,000 people would die, and in Denmark and Norway and Finland, they would have a few hundred deaths, people would have been as gung-ho in doing this experiment.
So many Swedes are thinking this was a very hard lesson to have to learn. Okay, Tino Sanandaji, unfortunately, we're going to have to leave it there. Thanks so much for being with us.